The number of 17 to 25-year-olds who self-report initiating heroin in the last year has increased, has doubled from 2005 to now, up to almost 200,000 youth. I think the reasons that it may be doubling is that the availability of prescription drugs from parents' closets, from prescriptions, has started almost an epidemic in the use of prescription drugs, which then can turn easily into an epidemic among heroin users. Part of the reason for this is an institutional forgetting, that the youth do not remember seeing the junkies by the wayside, and they certainly weren't in suburban areas in the first place. And parents forget, too, so that the negative view of what heroin is like is not as strong as it would have been, say, in 1978 or 1988, the last heroin epidemics. I guess the primary difference is that it's more geographically spread right from the beginning. It certainly is in urban areas, but it is in urban areas that are not traditionally heroin cities, like New York and Chicago. So you find it in Indianapolis, and you find a rise in Charlotte, North Carolina, places like that. It's also now in non-traditional areas around a city, so it is in rural areas, like the rise in Vermont, or in New Bedford, Massachusetts, where just recently they had 100 ODs in a very short time period, probably due to tainted heroin. So it's a much more diffuse kind of spread of the drug than it was before, which generally in the past it concentrates in urban areas. We have conducted the Arrestee Drug Abuse Monitoring Program, first for the Justice Department, starting in 2000, in 35 counties, and then for the Office of National Drug Control Policy, starting in 2006, in 10 counties. This is a face-to-face interview with all males who have been arrested in that county in the prior 48 hours. It's an interview that covers a whole range of things, including drug use, but it's everyone who's arrested regardless of charge. We also take a urine sample, all of which is voluntary, but we have a 90% agreement rate on the people who are volunteering to do this. And it shows us the truth, a gold standard against which that self-report is given. And we find that this is a population in which the heaviest drug users in the country are in the arrestee population. Demand is always what's driving the market. So if attempts to disrupt the market are always really important, but that's probably not where the resolution is going to be. It's going to be to reduce the demand. One of the problems with heroin addiction, as opposed to the addiction of some other drugs, is that it does require specialized treatment. Once the addiction's established, the person has a very difficult time dealing with cravings that even are there after the person has withdrawn from the drug. So we need addiction specialists who know, doctors who are licensed to prescribe buprenorphine, which is a very good drug for helping someone get off heroin. We also need access. Over the years since the last heroin cycle, a lot of programs have closed. I don't believe there is a single methadone program in some states. These have to be reopened, they have to be accessible, and people have to know about them.